decades, amputation has been seen as a last resort, a sign of failure after all other options for limb salvage have been exhausted. But recent advances are changing this narrative, pushing the medical community to reframe amputation as a reconstructive procedure aimed at restoring function and improving quality of life. Traditional approaches often disrupt the body's natural neuromuscular relationships, leading to issues like impaired proprioception and phantom limb pain. Ewing amputation, a novel surgical technique, was developed to address these deficits. By incorporating agonist-antagonist myoneural interfaces, the Ewing amputation aims to preserve or restore the body's natural biofeedback mechanisms. This innovative approach is not just about removing a limb, it's about rebuilding the foundation for movement, sensation, and confidence. Let's explore how this technique is transforming outcomes for patients. Ewing amputation's primary innovation lies in the construction of agonist-antagonist myoneural interfaces, AMIs. During surgery, pairs of muscles that naturally work together, like the tibialis anterior and lateral gastrocnemius, are surgically joined to mimic their original function. When one muscle contracts, its partner stretches, activating native receptors and stimulating neural feedback loops. This preserves limb proprioception, allowing patients to sense and control their phantom limb more naturally. The AMI constructs are anchored to the tibia using tarsal tunnels harvested from the discarded ankle, emulating movements like dorsiflexion, plantar flexion, inversion, and eversion. Early results show that patients experience less residual and phantom limb pain and report more vivid phantom limb perception. Electromyography and ultrasound confirm that patients can volitionally control these muscle pairs, supporting the theory that the Ewing amputation restores natural biofeedback and improves functional outcomes. Study followed 22 patients who underwent the Ewing amputation, tracking their progress through physical function tests and patient-reported outcomes. All patients were successfully fitted with prostheses, and functional testing was conducted both before and about a year after surgery. The results were striking. Patients showed significant improvements in nearly all performance-based measures, including the 10-meter walk test, timed up and go, 6-minute walk test, and functional read. Compared to normative data from traditional transtibial amputees, Ewing patients performed better, and in some tests their results were equivalent to able-bodied adults. These improvements were not only statistically significant but also clinically meaningful, indicating faster gait speed, reduced fall risk, and enhanced balance. The modified physical therapy regimen focused on AMI activation likely contributed to these gains. While endurance improvements were more modest, the overall findings suggest that the Ewing amputation, combined with targeted rehabilitation, can restore function to levels approaching those of able-bodied individuals. Ewing amputation represents a major step forward in reconstructive surgery for severe limb injuries. By restoring proprioceptive neural pathways, patients gain improved balance, confidence, and mobility, transforming their daily lives. The study's results validate the hypothesis that preserving phantom limb sensation through AMI construction leads to superior functional outcomes compared to traditional amputation techniques. However, the research also highlights the need for further studies with age, sex, and activity match controls to confirm these findings. The unique rehabilitation protocol may have independently boosted outcomes, suggesting that individualized therapy is a crucial component of recovery. As the medical community continues to innovate, the Ewing amputation offers hope for patients seeking not just pain relief, but true restoration of function and quality of life. Future investigations will explore whether these benefits persist or improve over time, paving the way for even more advanced limb restoration techniques.